Hi everyone, this is Dr. Kaveh Lahyun coming to you guys live again with another episode of Wellness Influencers. Today we are greatly happy to have Dr. Skip Wyss. Did I say it right?
Absolutely, you nailed it.
Perfect. We are very happy to have you here. He's a chiropractic. He's a chiropractor, pediatric chiropractic, and he has a wellness-based chiropractic clinic that's based in Green Bay, Wisconsin.
Yes, sir.
And so, without further ado, please give us an introduction, Dr. Wyss, and we'll go from there.
Awesome. Hey, thanks for having me on, Dr. Kaveh. I really appreciate it. What you're doing up in Canada is awesome, and I can't commend you enough for just putting out such amazing information for your patients and as unbiased and awesome as possible. And to bring chiropractic to more and more people is exactly what we need to do, especially the parents and with the pediatric population. Absolutely needs to happen. My wife and I, Dr. Julie Wyss, practice here in Green Bay, Wisconsin. We run a massive pediatric and wellness-based practice. We specialize in children. It's what we do. 70% of our patient population is actually children, and half of that patient population is under 3 months of life. So we see a ton of newborns and a ton of little kids, and we help calm down the hyper-stressed nervous system. And that's exactly what we do. And we absolutely love it. It's one of the best professions in the world, and you know this. And to be able to take care of our communities and take care of them at a standard that is so high, higher than anyone on this planet, chiropractic does such an amazing job at making sure that that nervous system runs, and it runs the exact program it's been designed to run. And this is what we do every day, and we love it. And that's why our office is always packed, and that's why we're always full. So it's a blast.
It's amazing. You can feel the vibration and positive energy and the passion in your voice, which I'm grateful for it, because we need more doctors to be passionate about what they do.
Yeah.
In your podcast, again, you have a podcast called the Prime Pediatric Podcast, which I highly suggest everybody should be listening to.
Absolutely. Well, absolutely love it.
In one of the episodes, you talk about when you treated your own firstborn, the whole paradigm changed. Give us a bit more details about that.
Okay, absolutely. It did. So I adjusted my daughter when she was 8 hours old. And see, when I was in college, at Palmer College of Chiropractic down here in the States, in Iowa, in Davenport, Iowa, which is the fountainhead, it's where the first chiropractic adjustment was given by D.D. Palmer. I mean, it's amazing that happened in 1895. And the thing is that when I was down there, and I was focused on sports, I was focused on athletes. I actually wanted really nothing to do with children. I didn't think children were going to be that big of a thing to me. And then Dr. Julie, my wife, ended up pregnant about a month and a half after we were married. And strange how that stuff happens. And then Peyton is with us. My daughter Peyton's born 10 months later. And I adjusted her at 8 hours old. And the reason why it took me so long is because, honestly, I was afraid. I was afraid to adjust a baby. I was afraid to adjust my daughter. The last person I wanted to be uncertain with was my child. And to have people around, to have everybody watching me, she was the first newborn I had ever adjusted. I had adjusted a lot of babies in clinic at Palmer College, and I had adjusted a lot of adults and a lot of children. Babies, a lot of babies, but not a ton. But infants, like newborns, I never had adjusted a newborn. And I had to completely rely on that inborn intelligence that I had in myself, my subconscious, to take over and adjust my daughter, which had to happen. And the minute that I adjusted my daughter, the second I relieved that nerve interference and changed that atlas position, that first vertebra in the neck, which is absolutely vital. So the parents that are listening out there, that first vertebra that's in your child's neck is the keystone to everything that runs that baby's function. And when that keystone is not in the right position, it causes the body to malfunction. And with my daughter, what I had noticed is that she was always looking at me to the left and not looking at my wife, which is the most beautiful person in the world, providing all the food source that she needs. Why would she not be looking at my wife? And she kept looking to the left and looking at me. And I was afraid. And for those doctors out there, those chiros that are listening that are slightly afraid of taking care of children and aren't quite certain, believe me, you have the abilities to do it. You have this innate intelligence to take care of kids, because your nervous system is hardwired to take care of other nervous systems. So have that power, and you know that you have that. So when I adjusted my daughter, I immediately knew that paradigm switched for me to immediately want to take care of kids, because as soon as I adjusted that first vertebra in her neck, she immediately looked to the right and looked at my wife and locked eyes with her and didn't change from that point forward. And my daughter just celebrated. She's 11 and a half now. And I made a statement about 6 months ago on her birthday in May. And I said, Peyton, you don't know this yet, but you changed the lives of millions of people to come. And it's because that I got a chance to adjust you when you were born. And had that not happened, I truly don't think I would be on the path I'm on now, and as driven as I am to take care of as many children as I possibly can, because we change lives, and we change lives from the minute the child is born, you see. And when that happened, that changed everything for me. And I can tell chiropractors one thing, and parents out there too, just get your child checked and get them adjusted if it's needed. And make sure that that nervous system fires at 100%, because your child will burn brighter. Their eyes they will have a greater energy. They will have this sense about them that they are chiropractically whole and that they are fully communicating, and they know this, and they thrive through life. The last thing any parent wants is a child that doesn't thrive. I'm a parent. I have 2 kids now. I would walk on glass through fire to take care of my child and provide them whatever care I possibly could. And knowing that chiropractic allows their body to stay in full communication at all times is a blessing to me. And my daughters who changed their life. And the thing that's amazing to me now is talking internationally and getting to be on your podcast and having my own podcast and just talking, the thousands and thousands and thousands of lives that she has changed because of that. And before I retire, the hundreds of thousands, if not millions of people that will have their lives changed. It's amazing what one pebble in a pond causes a ripple effect across the whole world. And that was a pivotal moment in my life. And that was 11 and a half years ago. And now here we are, just flying through life and changing tons and tons of children that come into our office all day. And I know you do the same up in Canada, which is awesome.
Yes, I do. Now, for our viewers, Dr. Wyss is starting to have courses in which he's teaching our chiropractors to be more confident, more knowledgeable with the test and examination that they do in order to provide the best treatment and best intervention at the time when they see the patient. And it's basically building your confidence up and making you a better doctor at any time you can. So let's go step by step. I know that you treat lots of expecting mothers and while they're pregnant. Why do you do it for? What's the benefit of it in your experience and clinical care?
Oh man, you're going to make me light up here. Taking care of pregnancies is by far my favorite thing in life besides taking care of newborns. And because there's 2 lives being affected at that time. And you have the life that's being put on and being put together in mom, running its own program, running off of a completely separate brain. Then you have mom, which is completely providing the entire environment for that baby to grow and survive in. And that environment absolutely needs to be perfect. Because we know if an environment is not perfect, whatever's growing in that environment either is going to adapt, and it'll either maladapt and malfunction, or it's going to overadapt and overfunction, but it's not going to function normally. And a chiropractic adjustment during pregnancy is absolutely vital, because if you view your pregnant moms and moms that are out there listening and tuning into this, think of it this way, moms. We want to look at your pregnancy in 3 phases. We want to look at it as power, passageway, and passenger. The 3 P's of life, literally the 3 P's. Number 1 is that passageway. We want to make sure that the passageway is in proper communication and in proper position, because if it's not, it starts interfering with how the nervous system talks to your uterus and talks to your placenta. You see, your baby, your amazing little life form that's inside of you, is connected to you via the umbilical cord. That's the power cord that connects your baby to you. You're supplying all the blood and all the oxygen that baby needs, but that baby is running itself and putting itself together, you see. And you have just as many nerve cells in your uterus at that time of baby being created as you do in your own brain. So do you not think that communication is absolutely vital for that baby to actually succeed in development inside of you, and then for you to actually succeed in your delivery of that child? it's absolutely vital to have happen. So as soon as we clear out passageway, then power turns on, and we make sure that that uterus is in full communication with that brain. And ladies, in you have the most amazing muscle ever, and it's called your uterus. It's phenomenal. It dilates, it contracts, and it rotates your baby into the proper position. So if we have the right communication, that dilation, that contraction, and that rotation works as a beautiful symphony in 100% harmony with your brain to know when to contract, when not to contract, and how to get that baby out. And then lastly is to make sure your baby gets in the best optimal birth position as possible. Chiropractors don't pretend to be OBGYNs. We're not midwives either. We're chiropractors. So we restore balance between your brain and your body, and we restore balance between your brain and your baby. And that allows baby to be super smart and get head down where it needs to be. And it's going to get in the best position possible. My job isn't to make sure babies go head down. That's not my job. My job and our job is to make we keep you clear and connected so your baby, so it can come out perfect. And that's what we do as chiros, man. And that's awesome, right, Dr. Calve?
It definitely is, my friend. It definitely is. It is one of the most valuable lessons in life that I have learned with my own kids, that when my wife was carrying our sons and she was treated on regular basis, the babies, my own experience, they came out much calmer, quieter, they thrived much better. And hand-eye coordination, and I can keep going on and on and on. But now, when the mothers are getting ready, basically to have to give birth, why is it essential to know that their nervous system is clear and firing properly and communicating properly with their brain? I think we lost you, Dr. Skip.
Well, I'm still here, but we've got some lag there, Dr. Calve.
That's okay.
Let me see if I can help out a little bit.
Sure, no problem.
Okay. You still there, Dr. Calve?
Yeah, I'm here.
Give me just 1 second. I'm going to try to actually change signals in a different room. Just give me one.
Take your time. No rush at all.
Okay. Let me see here. We're lagging, and I apologize.
That's okay. No. It's absolutely fine. Sorry. Don't worry about it. As long as we can get you.
Yeah, just give me 1 second. I'm going to transfer them. Hold on 1 second. My
video
is going to go blank for a second, but
no problem. That's okay. No worries. No worries. Well, while we are waiting for Dr. Wyss, it's very essential for us to make sure that our nervous system is functioning at its best at all time. Being a newborn all the way, basically from as soon as that baby is formed in the uterus, the communication between mother's nervous system and that baby is essential to make sure that the development of the fetus is done properly. And throughout the life, basically, once the baby is ready to come out and once it's born, the care of the nervous system should be integral part of anybody's wellness. So just to make sure that everybody gets the care they need for the conditions and making sure that we are doing our best. All right, fantastic. Now we can have you. Great.
Let's see if this works, Dr. Calve. I've switched into the room. Maybe we can get better reception in here with my Wi-Fi and different internet connections. Trying to make this work, and I really
it is fine as long as we can have the conversation and your voice. Hey, listen, such a good-looking doctor. I don't know. I get a little jealous for you when you come on. So.
hilarious.
All right. Now, we were talking about the babies as close when we get closer to the birth process. Why is it essential to make sure that our nervous system and brain are functioning properly?
It's absolutely essential, because if they come out and they're not communicating correctly, you're going to find a major problem with the child itself. You're going to see major changes in function, which is a serious problem. Now, what we're going to notice first as parents is we're going to see changes in breastfeeding. All babies should breastfeed. Remember, they're learning how to suck their thumb right around 20 to 23 weeks in you, mom. So when we don't have the right communication, so when they come out, remember, when they come out at 40 weeks, they've learned how to suck, swallow, and breastfeed on their hands, which is going to be a little bit of user error going to breast tissue, but they should still know how to do it. And the first thing we notice is that if a kid cannot breastfeed, we immediately have a change in function. That's a first indicator, because they've lost the primitive being of being able to suck and swallow on their hands. And that is absolutely not okay. And it gets overlooked time in and time out again. Even here in the States, up in Canada, everybody overlooks it, because what's happened is we've become convenient. We've actually changed convenience for moms. And I don't mean that meanly, moms. I mean that with all love. What's happening is we're changing and making things convenient. So if your baby can't breastfeed, we immediately start introducing bottles, and we immediately start introducing formula, which what we should be looking at is actually immediately introducing chiropractic. So we can start introducing the nervous system and getting that handshake back, getting that brain to body communication, that neurological handshake back where it belongs. So now baby can start to suck, swallow, and breastfeed exactly how they're supposed to. The other thing is children should be able to sleep. And if babies are not sleeping correctly, if they're not getting a good 8 to 10 hours of sleep at night, sometimes 15 to 16 hours, and waking every 2 to 3 to feed, we have a problem with the nervous system not communicating like it's supposed to. And that is 100% not okay. Everybody looks at that and completely surpasses it. The other thing is babies, when they come out, they should be going to the bathroom on a regular basis. They should be pooping on a regular basis. They should be dirtying between 4 to 6 diapers a day, at least, in bowel movement, not peeing, just bowel movements alone. And when that doesn't happen, that shows me there's an absolute change in bowel structure, change in function. And what runs this function is their brain. So it absolutely is essential that it stays in full communication. And the thing is, moms, my heart goes out to you, because the minute you find out you're pregnant, a lot of the time your care providers look at you and say, you have a 10-month parasite in you and we need to get this baby out. And what happens then is they put you in a hyper-stressed state, and it's completely unfair to you, because this is a time of bonding. This is a time of creation. This is a time of beauty. Ask any artist that has created a masterpiece if they hated creating it. It turned out like crap. But if they love creating it, and they loved putting it together, and they put it together in a peaceful, amazing environment, that artwork turns out to be a masterpiece. And that's what every one of your children are. So why wouldn't you want an environment where you're completely non-stressed? Because what happens is if somebody starts stressing you out and starts putting time frames on you and telling you when your baby's born, and if it's not here, this is what we're going to do, and we're going to go in and harvest your baby, and we're going to do a C-section, and we're going to pull them out, what happens is it causes you to be extremely stressed. And that's not okay, because what it does is it raises a neurotransmitter in your body called cortisol. And that cortisol, that hormone, directly inhibits and slows down your immune system, and it raises your stress. So what happens then is your baby comes out with that high level of stress hormone too, and it's addicted to that stress hormone. And that's not okay. And then they come out hyper stressed. And this is the child that either cries nonstop or doesn't cry at all. And if that child does not cry at all, they're already in a state of past crying shock. And that's not okay either. That's even more concerning. So these are the things, mom, to watch for. And this is why chiropractic helps, because what we do is when we adjust, we balance the nervous system. We take the body, then balances and takes away the internal stress. It takes away that high neurotransmitter, that high hormone called cortisol. It reduces that stress. And then you increase things like dopamine and acetylcholine. And these things make you feel amazing. These things help you level yourself out. These things change your mindset. And this is where chiropractic helps everyone. And this is the ability that we do when we help you as parents. This is what we do.
I often tell all my patients that we really don't treat a condition. but
No,
we enable this body and the innate in it to basically function at its best,
exactly.
taking care of the problems as the body sees. And
Exactly.
that's what happens, that you don't have to tell your body, if you cut it, you're going to have to heal it. It heals it by
Mm-mm.
itself.
Mm-hmm.
So we bring about the environment in which our body maximizes its healing potential
Mm-hmm.
when the nerve interference are taken away.
You know
So
what's amazing? What's amazing, Dr. Cave, is if you think about it, parents, if you're listening, and Kairos, if you're listening too, think about the beauty of the brain and the amazingness of the brain that runs your body. 1 second of brain function, of literally neural cellular function in your brain, will take the smartest supercomputer on earth 45 minutes to run 1 single second of processes in your brain. It'll take it 45 minutes. Think of how special you are. Think of how
yeah.
amazing that your body has to actually heal itself, and that innate intelligence to run and put itself together all the time, as long
Mm-hmm.
as it's communicating like it's supposed to be.
And I know when it comes to pediatric care, I mean, what can I say? You have made pediatric care what it is right now, and
Oh,
listening to you teach it, and the examinations are absolutely amazing. I was awed when the examinations that you were talking about. It's truly inspiring to know that there's people like you out there who take care of little spines and give them a huge chance in life. So for little ones, what do you recommend? Now they're born, what do you recommend from there on?
they need to be checked immediately as soon as they're born, if they can be, or we need to get to them in the first 3 to 4 months of life, is what I say. I want to see all children before they're 6 months. I want to see them before they're 4 months. In fact, I'd like to see them before they're 2 months. That's why we see so many kids that are under 3 months of age. But the biggest thing is making sure that we stay in full function at all times, and we stay in full communication with that brain to that body. That is absolutely key. And moms and dads that are out there listening, the American Academy of Pediatrics actually came out with a research study years back saying that the average child falls around 400 to 500 times in their from 12 months to 2 years old. What happens from 12 months to 2 years old is when you learn how to walk. This is when you learn how to actually move and run and fall and tumble. And they consider half of those falls, between 400 and 500 times, are significant enough where they should be checked by their medical doctor. They should be checked by their pediatrician. That's a very significant fall. But here's the thing. Now raising 2 children and seeing hundreds and thousands of children in this office, how many parents stop and pick their kid up and rush them off to the doctor every time they fall? It's
Mm.
those repetitive stresses to the spine. It's that malfunction that's already there, and that repetitive stress just amplifies the malfunction in these children. And what happens then is these children end up have a hyper stressed nervous system. That's called a big word that we use in chiropractic called disafferentation. That's a massive word, but basically what it means is the lack of communication from your body back to your brain. And what's more significant with that is that from that comes another word called nociception. Think noise, too much noise in the brain. So what happens with children is they get under hypersensation and they get under hyperload, and then they get too much noise in their brain. And this is why they'll have problems processing. And this is what we see in chiropractic all the time, is we'll see this change in kids that are hyper stressed. And that's not okay. So what we do as chiropractors is we reduce that internal stress by adjusting those babies and getting them back, and adjusting those children and getting them back into proper communication. That's what we do. You can look at the science behind it. That's how chiropractic works. And these are the things that we do all the time. So do we see tons of kids in here with all sorts of issues? We do. Symptoms can be anything under the sun. But guess what? Function is always key.
Mm-hmm.
And if something is malfunctioning in your child, if that nervous system is not communicating how it's supposed to, we're going to see a myriad of symptoms. And they range all over the board. But bottom line is that if you can restore function, that child will heal how they're supposed to. That God-given right to heal is inside that brain. And that brain will heal. And it will heal that body. It does time in and time out. No matter if they're 2 months old, a newborn, or 60 or 70 or 80 years old, the body will always heal.
And obviously, for examinations, there's specific examinations that we do at pediatric care. to examine our patients. We are looking for different stuff. Some of the stuff that you do for examinations, what are you looking at? What are you trying to examine? What are you assessing?
Okay, so what we're doing is we're assessing function. So right away in little ones, especially in newborns, we're going to assess their primitive reflexes. So what that is actually the inborn reflexes that are hardwired into your child from 10 weeks inside you to 37 weeks inside you as a mom. And these are all the reflexes for survival that they need to have when they're born. If they're born and they're lacking these survival reflexes, what that does is that changes their ability to survive. It changes their ability to thrive. So we check all of those. We check root, we check latch, we check acoustic blink, we check what we call an ATNR reflex, which is, we like to call it the where's the beach reflex. It's the one where you look to the right and their arm straightens out and their left arm comes up, or they look to the left and the same thing happens. These are all designed to take your child out of a protection flexion state, which they're all born in like this, and get them to open up, thrive, and stand and get bigger. This is called parasympathetics, and this is what we want to have come on in children because that allows them to heal, you see. And then we look and see, are they turning their head in the right direction? Are they blinking like they're supposed to? When I touch their hand, do they grab my hand and hang on to it? It's not because they like me or because I smell good, okay? It's because they have a primitive grasp reflex. This needs to be there because guess what? This is how they hold on to mom. This is how they stay on you. This is why they grab your clothes. They want to stay tight to you, and this is that reflex. Also, when you touch a baby's hand, they're going to turn towards their hand and open their mouth. That's the feeding reflex. That's putting stuff into their mouth. This is all primitive there so they can survive, because here's the deal. If your child does not feed and eat when they come out, they don't survive. And if we are constantly inundating them with easy ways to survive, which is fine, this is called medicine and it helps, but there's also the true function that's there where they shouldn't have to have that external input to run the program that they already run inside of them, see? And so chiropractors check for this. We also check and see, how are the nerves talking to the stomach? How are they talking to the bowel? How are they talking to the gut? Are they causing the legs to fire like they're supposed to? Are they having the reflexes they need to have to learn how to first roll over, then sit up unassistedly, rock back and forth, crawl, and then walk, and then talk? And are they progressing in that linear fashion to make sure that this brain, this beautiful brain, is coming online, parents? And the thing is, parents, and I think this is something that I think any of you listening can understand. You see, when your amazing brain functions and develops, it develops from the bottom to the top. It develops back to front, and it develops right to left. So chiropractors will look at this, and we go way in depth on this, and that's okay. But let's keep it as simple as possible, because when you keep things simple, you lead to perfection. And if we can look at how the brain's functioning bottom to top, so we look at all those reflexes that are here in the lower part of the brain. And then what we want to see is, as that child develops, are they developing a personality? Are they developing interactions? Are they talking to people? Is there social awareness where it needs to be? Because I'm telling you right now, Dr. Cave, when we're seeing kids shooting up schools and being completely disconnected from their environment and showing no affect for putting their fellow man in danger, that's a serious problem. We're lacking communication here. We just had another active school shooter 65 minutes south of here today. And yesterday we had one down in Waukesha, which is by Milwaukee. And I don't mean to get shook up, but this isn't okay anymore. Mm-mm. This stuff is not okay. And to sit around and to look at this and say, it's just a kid developing, they're just out of sorts, they're disconnected. Well, where is that disconnect really? Is it in parenting? I really don't know. Is it an actual social disconnect between the brain and the body and its ability to actually perceive what's good and bad? I think so. And see, we have the answers for this as chiropractors. We have the ability to allow these children to function like they're supposed to. And that frontal brain development is absolutely key. And if something here is not in the right position in affecting that frontal brain development here, because parents, this is where all of your kids' personality comes from. If it's not there, there's a disconnect. And that's not okay with me anymore. And I'm not okay with the environments that we're in right now. It's just not okay. And chiropractic is who helps us.
I mean, I'm sure our viewers can hear the passion in your voice, and truly, it's everybody's responsibility. It's my child, my brother, your brother, our sisters, our mothers. We are a community, and if we don't rise to help ourselves, nobody else will.
It's the truth. It's the truth. And my chiropractic brothers and sisters that are out there, if you're uncomfortable taking care of children, or things just aren't quite simple and easy, this is what stops us from progressing forward and helping each other out. So let's make it simple and beautifully complex. Let's make it so things come out perfect and we can help every child, because this is my concern, is that we're missing these children. And then another thing pops up in the news, and another thing pops up in the news, and in my mind it's another missed child. And it's not okay with me anymore. It makes me really sad. And I don't mean to take that from here, but that's called putting my heart on my sleeve. It's one of my biggest issues, and I always lead with my heart. And sometimes it comes off as angry, and I apologize. But it's the fact that this thing is what powers all of us, right? It's our soul, it's our heart. And it makes my heart hurt when I see this happen to children. When I know that chiropractic, that we have the answers to help.
It's amazing that through the years, I mean, I've been in practice for 20 years, and I always get, practice members who come and say, you know what, doc, there's nothing wrong with my kid. Why should I have you check him? Or should I wait till they have growing pains, or do they fall? And my answer is always, the best day to treat a spine is their best day without any symptoms. Because once you have symptoms, it's generally a little late. So we have to work backwards.
It is.
What do you tell your patients?
Symptoms are always the last thing to show up. One of the easiest things to talk to our patients about, and you that are out there listening, is remember your body works in stages. It goes from a state of miscommunication to dysfunction. Dysfunction will always go unnoticed unless somebody points it out to you, either the range of motion of your spine, a posture change in your child, a change in their muscles, how they're standing, their personality. All of that goes unnoticed because you're around them all day long. Think of it this way. If I see you, Dr. Cave, if I see you every day and you're losing weight, I don't notice that you lose weight until you've lost like 30 pounds.
True.
But if I don't see you for weeks and I come back and see you in 3 months and you're down 10 pounds, I'll see it in your face immediately. So things just need to actually be pointed out to us so we see them. So it's the stuff that we see every day just doesn't become everyday background fodder, okay? So what we do with children is we're constantly checking that stuff. As a parent, you need to always come back to that so things get pointed out to us. Then what happens is the body gets into a state of dis-ease. And this is clear because, and I'm going to perform a really cool magic trick for you. If I take the hyphen out in dis-ease, what word does it become? Disease. Okay. And disease is what medicine treats. Chiropractic doesn't treat disease. We help the body function to alleviate dis-ease, which literally means not healing, not calm. Ease is a state of healing. Ease is a state of calmness. And if we have not in front of that, that means the body is in a disarray. And that's where we check this and we find the state of dis-ease. Because if dis-ease is long enough, now it becomes symptoms. And symptoms can show up in any form. We have patients that come in all the time. I have kids that come in nonstop with constipation issues, and we adjust their upper neck and it clears their bowel out. I have kids that have problems breastfeeding. We adjust their low back where the subluxation appears and it clears out the breastfeeding issue. It's about restoring function and not treating the symptom, because guess what? If I treat your symptom, I am no different than you taking medication for a headache. We're no different than that. So all we're doing is we're trying to treat a problem instead of proactively restoring function so the problem never happens in the first place. It's called proper maintenance and it's called proper care.
Which is, maintenance is all where it is. I mean, an ounce of prevention is better than a pound of cure. So we all know that. Now, I know one of the things that you pick on lately was the sugar. You said the last 3 months of this month is the is the most unhealthiest time of the year for us, which is true.
It actually is. It actually is. And then what we do is we try to make up for all of it in January because it's but it actually is, because if you look at marketing aside, you know, it's never, this isn't cold and flu season. This is sugar season.
That's right.
It is. If you start from Halloween, if we look at if we look at the United States holidays and even the Canadian holidays, Halloween kicks off everything. Okay, because you guys celebrate Thanksgiving in Canada, the beginning of November or October.
It's the second week of October.
Okay, so you actually kick it off. You're guilty of it. Okay.
Yeah,
so,
we do.
It's like you guys deal in kindness and in sugar. No wonder maple syrup comes out of you nonstop. So, but if you think about it this way, sugar season is actually what depletes our nervous system. Sugar actually is very, very pro-inflammatory. Sugar causes stress inside the body. So what happens then is if the internal environment of the body is stressed, any sort of external stress that comes in, whether it's in the form of viruses, the form of bacteria, the form of any sort of toxin that comes in from our environment, affects our body then negatively instead of our body getting ahead of it and fighting it. So if the body is constantly under stress, if there's nonstop fire going on, and I go and put more sugar in, all I'm doing is adding gasoline or an accelerant to that fire. So I'm just making things worse. So these last 3 parts of the year, it's not because we don't have enough flu shots, okay? It's because our body doesn't have enough of a proper immune response to fight off the virus that comes in.
Yeah, to recognize the virus or the bacteria and to fight it with enough soldiers properly. Yes.
Exactly. And in this case, you see study after study showing vitamin D being much more effective at fighting off any virus naturally than anything that they can put into the body. And the vitamin D source comes from the sun and it comes from fats. It does not come from sugar. And some of the most highest fat containing foods are not sweet. You see the background here. Now, I'm not telling everybody to go out and eat 1.5 pounds of butter every day, but you need to have good fats in your diet. You need to have really good fats. You need to have organic butters. You need to have animal fats. You need to have duck fat. You need to have things to bring in the fat soluble vitamins that actually run your immune system and run your nervous system. And the thing is that sugars aren't all bad. There are a group of cellular-based sugars that are in our body. There's 17 simple sugars that run all the cells in our body. But the thing is that those are not coming in from high fructose corn syrup. They're not coming in from candy bars. They're not coming in from candied yams, and they're not coming in from apple pie. See, I'm not telling you to not eat sugar every now and then. I understand that. But live by a life of 90-10 or 80-20, where you're constantly eating 80% of the time you eat very, very healthy, 10 to 15% of the time have a little sugar, but don't be downing them nonstop. And you see kids are inundated with this now all the way through Christmas. And see, as adults, now here's the other thing. Here's the kicker as adults, and we're all guilty of this. There's a little substance that goes around the holidays, and it's called alcohol. And it starts right around Thanksgiving, and then it goes through to Christmas, and then it goes into New Year's. And we're all guilty of it. We have some beer, we have some wine, whatever. That's all sugar. So when I hear parents that come in and say, man, my kid got me sick, I'm like, did they get you sick, or is your immune system just not running well? Or are you just expressing symptoms trying to get rid of the virus that's in your system? Because what happens is we start looking at the symptoms that our body's doing, which is a normal immune response, as being sick, when chances are that virus has already been there 1.5 weeks to 2 to 3 weeks already before we start actually expressing symptoms of colds and snotty noses and tiredness. That's all your body trying to fight the problem, trying to fight the virus. So if we keep you adjusted and we get sugar down, you can amply fight viruses. So if you're having fun on your weekends, enjoying your holiday parties, but if you're indulging a little bit too much in liquid libations, that decreases your immune system. It does every time. So when your little yeasty beastie comes home with a virus from school, guess who's going to end up with it, and guess whose butt it's going to kick? It's going to kick.
That's right.
Does that make sense?
It does. Dr. Wyss, I mean, talking to you is an absolute delight. You're a mountain of knowledge with I just can't get enough, but I know time is limited. I am grateful for you sharing with us your clinical knowledge and experience and evidence-based experience that you have had through your clinic, which is wonderful to know there's people out there who put their heart out in order to make sure that we don't suffer, our kids don't suffer needlessly where they don't have to. Now, where do our viewers can find you? A website, handles. We talked about your podcast too, so please give us a list of them.
Yeah. So there's a few ways you can find me. I actually have a podcast called the Prime Pediatric Podcast, and that's designed for chiropractors to listen to, but I have a boatload of patients that listen to it, which I find awesome, because if they can stay up with that, that's pretty impressive. We also have the clinic, www.wyssclinic.com, wyssclinic.com. You can find me on Facebook at Dr. Skip. I'm Skip R. Wyss on Facebook. You can follow the clinic. You can follow the podcast. And also for chiros that are listening, we have an amazing program that keeps pediatrics simple. And if we can keep pediatrics simple for our chiros, everybody out there, everyone has the ability to take care of kids. Every chiropractor, you have the ability, you have the knowledge. Let's just keep it simple so we can keep it perfect. And then that way we can get the best confidence clinically, so you can take care of these kids at whatever rate you want, so you can take care of them. And that's the key. So they can find me at the Prime Pediatric Program as well, primepediatrics.com. Primepediatricprogram.com will also, you can find me there too. So I'm available in a lot of places. Just come find me.
You sure are. Me. I have to say, you are a very hard guy to pin down. This interview took about 4 months of training. And I have to say, it was pre-planned, obviously. And a couple of times it got canceled because your flight to a different speaking engagement.
Yeah, the weather played a really crappy role the last time, Dr. Cave, and I'm sorry.
That's right. No. Hey, listen, I'm happy to have you here. I thank you for your time. Thank you for giving us the pearls of wisdom as you see it in your clinic. I'm grateful that you could come. If you have any parting words, please, this is the time to say them.
Chiropractors, if you're not comfortable seeing children, it's time to get comfy. And it's time to lead with your heart and take care of every child that comes into your office, and knowing that what you do will change their life. Parents that are out there, please get your children checked by a chiropractor that understands how to take care of children. Please, I implore you to get them checked. Your child's immune system, their development is depending on it. Just get them checked. There's no harm in that. And if there's something that needs to be taken care of and corrected and getting function back in your child, do it. I'd do it. Do it. That's what we do every day. So thank you, Dr. Cave. I really appreciate you. You're awesome. Keep doing what you're doing, man. I love your show. I love what you're doing. And just keep doing it. It's making a massive impact.
Thank you, my friend. I'm grateful for you to be here. Hopefully we will get you in another perfect time. Thank you again and have a great day.
Thanks, Dr. Cave.